Hi, my name is Susan Latham, and here's my ID, my government issued ID. So thank you for reviewing my Capstone project. My project was to write a systematic review. So the topic of my article was how training, education, and other interventions impact patient safety and quality of care in long-term care and rehabilitation facilities. I submitted the article for publication with the American Journal of Nursing. I got a positive email back yesterday saying that they're very interested. It doesn't mean it's going to be published, but they are interested. And so I'm just waiting for a final decision, which will take 4 to 6 weeks. So now I have my little rubric here so that I make sure that I don't forget anything in my PowerPoint. But for my introduction, I did a systematic review. And when you're writing a systematic review, they like you to collect your articles in a systematic way, and then they like you to write and put the paper together in a systematic way. And I imagine that is why they call it a systematic review. So, the benefits for the healthcare providers and for me as a student in doing this paper were to learn about patient safety and quality of care in nursing homes and really change the way we deliver care. So that would be both the benefit to myself and the people that I'm sharing the article with. So the criteria for selecting my preceptor, I wanted it to be somebody that had experience in long-term care. I found an advanced practice registered nurse that I used to work with who now works at an LTAC, and he has extensive experience as a director of nursing for a nursing home, and he has experience in long-term care. So I asked him if he would be my mentor for this project. The purpose of my practicum goals is to synthesize current literature into an article and publish it to understand what types of interventions improve patient safety and quality of care in nursing homes and to share that finding with other people. Okay, so an analysis of the project were that okay, so when you write a systematic review, they like you to find your articles in a systematic way. So they don't like you to just pick articles that you like. In fact, they don't want you to do that. They really want you to find a systematic method for choosing the articles to begin with. So the way that I did it is I did a PICO search and a term search on PubMed or the National Library of Medicine. And the environment that was being observed were residents in nursing homes. So I really wanted to know about patient safety for residents in nursing homes. So that would include rehabilitation, the rehabilitation section of a nursing home too. So I used the MMAT and the AmStar and Prisma to appraise the literature and to write the article. So the MMAT is the mixed method appraisal tool. And this is used to evaluate quantitative, qualitative, and mixed method studies. So basically, you use this tool to make sure that you are unbiased in choosing which ones that you're going to include. The AmStar is for appraisal of systematic reviews. So if you're using a systematic review within your systematic review, you use the AmStar. And the Prisma guidelines are just to help you to put the paper together and to do it in a way that's organized and in a way that people are going to understand. Some issues and difficulties and changes in my schedule in doing my Capstone project were that the project had to be changed completely. I already had the learning plan done, and I had already met with my preceptor, and we had already made a whole plan of how I was going to complete this project when I was given this feedback. But I decided that, you know what, I've always really wanted to be a published author, and maybe I should do this instead. Maybe it might be a better thing for my Capstone project. And so I got some feedback that maybe it would be hard to complete the project I originally wanted to do. Maybe it was too complicated. So I decided to just do this instead and to write a systematic review. So the evidence I have of collaboration and decision-making with my mentor is that my mentor is going to be listed as a co-author. When you submit a paper with the American Journal of Nursing, They ask you if you have anyone that's helped with the paper, and that would include like a mentor, a reviewer. They don't necessarily need to have written any part of the paper, but they need to be involved in some capacity. So I put my mentor down as somebody who was involved in the writing of the paper, and he will be listed as a co-author. And so he has to approve the manuscript. There are steps that he has to take in order to get that done. And so that is evidence of collaboration with him. What is a systematic review and how do you begin? Okay, so once you have all of your articles chosen, then how do you write the article? How do you do the whole thing? So a systematic review is a systematic compilation of current evidence-based medical literature to synthesize and appraise on a specific issue. Since this is a systematic appraisal of literature, the search must be obtained in a methodical way. So I began in the National Library of Medicine PubMed using the PICO tool. So here's a little snippet of the PICO tool. So the PICO tool is just this tool where you put in some search criteria for articles and then it gives you results. And then you can use those articles for your systematic review. So here are my search terms: nursing home staff, training, education, and safety. And then from my PICO search, I had 311 results. I also did a term search in PubMed where I used very specific terms that were outlined in my paper. And then I also had results that met my eligibility criteria from that search. So I had 27 results there. After you have all of those articles, you need to have some sort of tool to appraise the articles to decide if they're going to be appropriate for inclusion into your systematic review. So to begin with, I made some eligibility criteria. They had to be articles that were written in the last 5 years. It had to be current research. It had to be relevant for the topic at hand. And then I used the mixed method appraisal tool to appraise the article to make sure it was an appropriate article to include. And the only question that I had is, how do you appraise systematic reviews? Because with the MMAT, you can appraise qualitative, quantitative, and mixed method studies, but you cannot appraise a systematic review. So this is a little snip of what the MMAT looks like, and this is a little snip of the Excel spreadsheets that I made for each one of my articles that I appraised before I included it in my systematic review. So what they want you to do is they want you to ask what type of study was it? Was there a clear research question? Did the data in the article actually answer the question that they were asking? And so I used the MMAT to appraise most of my articles, but what was I going to do about the systematic reviews? That is where I found the AmStar, which is a tool to evaluate my systematic reviews. And so you can look at that if you'd like. And then here is an example of an Excel spreadsheet that I made about my systematic reviews. So here's a picture of me answering the questions for the MMAT and the AmStar. So did I make a checklist for all 311 articles? No. Only for the 23 articles that were included. What articles were included? Those that met the date range criteria, the topic at hand, and those found in my searches. So my objective set of articles that I actually ended up including in my systematic reviews were found through a term search and a PICO search. These are all the terms I used to search with in PubMed, and out of the 311 articles generated through the PICO search, 300 were excluded and only 11 were included. And then the 27 articles identified through the keyword search, 12 articles could be included after appraising the articles, using the MMAT, or excluding them based on my inclusion-exclusion criteria. So I could exclude a lot of these articles just based on the fact that they were written 20 years ago and I want current research. So a lot of them were just eliminated that way, or they didn't fit the topic at hand. They didn't fit what my question was for the systematic review. So the exciting part of this whole thing is that once you get all of your data together and you synthesize it, you learn things. And I learned that technology and not education or training would be the most important intervention for patient safety and quality of care in long-term care facilities. So this was an important finding. The way that I came up with this is that technology was found to be the most effective intervention. So what I did is I separated all of the articles into 4 focus groups, depending on what types of interventions they were trying to implement. And then at the end of the article, you can tell if the implementation of these interventions was effective or if it wasn't effective. And so I just looked at the percentage of studies in each focus group that had effective interventions. So for staff education and training, it was 43%, technology was 80%, workforce crisis was 33%, and CMS interventions were 40%. So technology was the clear winner at having the most effective interventions. So this is just explaining the 4 focus groups and how I came to that conclusion. I also did an annotated bibliography, and I made a table to organize all of my data. Here's an example of my table that I used in my article. For each article that met the inclusion criteria, I gathered data about that particular article to look at the types of interventions they had for patient safety and quality of care in long-term care facilities. And so the PRISMA guidelines helped me to put the whole paper together once I had all of my data organized. And so, yep, there was a checklist to help me put it together too. So just like there was a checklist to help me appraise all of the articles, there was also a checklist to help me put the whole paper together. So, and these were all of the references that I used. And for publishing, some journals are more professional than others. I decided on a peer-reviewed journal. And I was examining different journals all through the writing of the paper. So the American Journal of Nursing is the one that I chose, and so I needed to follow all of their instructions when submitting the manuscript. So this is where I went to understand all of the instructions. And then I needed to make a login so that I could submit my manuscript, and I needed to submit my ORCID ID. So what is an ORCID ID? It's just basically a resume where they're asking, who are you and are you qualified to write about this in the first place? Where have you worked? Like what is your experience? So ORCID is just all about you, and the process of submission looked like this, where I had to go through all these specific steps to finally submit the manuscript. Part of it was adding my other 2 authors. They were added as a reviewer and as a mentor. So they didn't actually write any part of the article, but they were added as co-authors, as having contributed to the work in that way. So it'll be 4 to 6 weeks before I'll have an answer. I have 2 other authors, and I'm just awaiting a decision. And so the evaluation and conclusion, I finished the article, and once it was finally done, it was 44 pages and 3 tables. And you can see in the previous slides all of the references that I used. The benefit to others will be just sharing my findings of synthesizing all of this information from all of this evidence that's been published in the past. The benefits to me as an author, I learned how to properly investigate current published literature that provides insight about evidence-based practices, and I also learned about what would improve patient safety and quality of care moving forward. And my self-evaluation of my leadership skills are that it's hard to get other people involved and to ask them to be involved because it takes work and you're not getting paid for it or anything, so it's kind of awkward and difficult to ask people to do that. But I have further developed skills in this area, I think, and how the project will impact my future practice. I will be more mindful of how technology can improve patient safety and quality of care. I did not know that technology would have the highest percentage of effective evidence-based interventions for patient safety and quality of care. So that's something that I learned. So what I learned was that, and I would like to create some technology in the future that would help people to go directly to the evidence-based regulations that are put in place by the government to improve patient safety and quality of care on ecfr.gov and cms.gov. And technology was my clear winner. So technology for frontline staff might help them to improve patient safety and quality of care. Just knowing how to get to the evidence-based instructions and regulations that they should follow to improve patient safety might help them. So that might be something that I'll look at in the future. So again, thank you for looking at my project, and I will look forward to looking at one too.